Hi, everyone. My name is Alyssa, and I'm a clinician at the Wellness Center. And I will be presenting an introduction to psychological assessments, and I'll be talking about why they are important. So, in this presentation, I'll address what are psychological assessments and the difference between psychological assessments and psychological testing, who conducts the assessments, what the process of the assessments is really like, and I'll end off with the importance of assessments. So, psychological assessments. This is the process of gathering, integrating, reviewing, and interpreting psychology related data to make a psychological evaluation. Now, psychological assessment, it involves more than just testing. It uses tools such as interviews, case studies, behavioral observations, and specially designed apparatuses such as psychological screeners and tests. So it aims to answer a referral question, which is the question that we are trying to answer that led to the assessment. It aims to solve a problem or arrive at a decision, such as a school or special program placement. Now, assessments are individualized, which means that an assessment is tailored to the needs of one specific person. So, after gathering the preliminary and background information, the psychologist then analyzes the information gathered and comes up with an assessment battery that will address the needs of that client. So, on the other hand, a psychological test is a set of items that are designed to measure characteristics of humans that pertain to behavior. So, it may measure different sorts of psychology related attributes such as math ability, depression and anxiety levels, personality, and much more. So, some examples of psychological tests are the Stanford Binet intelligence scales and the Wechsler tests. Now, conducting a psychological test results in a score that is usually numerical, and it may be administered to an individual or to a group. So, there are different types of psychological tests, and these are ability tests and personality tests. So, ability tests, they measure the skills in terms of speed, accuracy, or both, and are further divided into three types. We have achievement tests, aptitude tests, and intelligence tests. Now, achievement tests, they measure previous learning, such as spelling or math tests that are taken in schools. So SATs and ACTs are also achievement tests that measure an individual's college readiness. Now, aptitude tests measure one's potential for learning a skill. So, for example, they can measure how easy it is or how easy it would be for a person to learn how to bake a pizza. Now, intelligence tests measure a person's general ability to solve problems, to adapt to changing experiences, to think abstractly, and profit from an experience. So, an example of this is the WISC, or the Wechsler Intelligence Scale for Children, which provides a full scale IQ score. Now, on the other hand, personality tests measure a person's typical behavior. So, structured and objective tests present a statement that a person responds to. So, responses may come in the form of yes or no, true or false, or a Likert scale, which presents options such as always true, sometimes true, never true, etc. So, projective tests provide an ambiguous stimulus that an examinee tries to interpret. So, an example of this is the thematic apperception test, whereby the examiner presents a picture and the examinee tries to actually narrate what's happening in that picture. And so there's four important characteristics that a psychological test must have. So the first is that it must be standardized. Now, what does this mean? This means that the test is uniform from one examiner to the next and from one setting to another. Now, the same questions, materials, and instructions are presented to the test taker and is administered in a neutral environment free from external distractions. Now, usually, a testing room is plain and undecorated and free from clutter and unnecessary items and is away from potential noise. So, next thing, a psychological test must be objective. Now, objectivity means that the test is independent of subjective judgment or of any particular examiner. So, any test taker should obtain the same scores regardless of who the examiner is. And third, a psychological test must be reliable. So, a test taker must obtain the same score when retested with the identical test or an equivalent of the test. So, for example, taking one IQ test should yield the same IQ score as when one takes a different IQ test. Now, finally, a psychological test, it must be valid. So a valid test shows that it measures what it's supposed to measure. So an English test must evidently measure English achievement, and a performance test must evidently measure one's performance. So basically, psychological assessment aims to answer a referral question, to solve a problem, arrive at a decision. It is tailored to fit the needs of one individual and is led by a psychologist. Now, on the other hand, psychological testing is one component of the entire psychological assessment. So it aims to obtain scores that are usually numerical. They may be administered to individuals or groups and is administered by either a psychologist or a psychometrist. So, who conducts the psychological assessments? There are several professionals who work with assessments. So, first off, we have clinical psychologists. Clinical psychologists hold a doctorate or a master's degree and specialize in providing continuing and comprehensive mental and behavioral healthcare across one's lifespan. So they may provide psychotherapy services or counseling services, and they are licensed to diagnose. Their specializations include assessment, using interviewing, behavioral assessment, and administration and interpretation of psychological test measures. Now, next up, we have developmental psychologists. Developmental psychologists also hold a doctorate or a master's degree, and they specialize in human growth and development that occurs throughout the entire lifespan. So this development does not only include physical development, but it also includes cognitive, social, intellectual, personality, and emotional growth. So in most countries, they are also licensed to diagnose. Now, next up, we have educational psychologists. Now, educational psychologists, they also hold either a doctorate or a master's degree, and they specialize in supporting children with learning difficulties or communication needs. So, educational psychologists, they work in collaboration with schools, specifically with teachers, guidance counselors, and learning specialists, and SENCOs, and they help to meet the needs of young people who are finding it difficult to manage their emotions or perform to their best abilities in academics. Now, psychometrists may either hold a bachelor's or a master's degree, and a psychometrist's main task is to support the leading psychologist by administering and scoring psychological tests under the supervision of a psychologist. And after administering and scoring a psychological test, scores and all other data gathered such as background information, family history, medical and developmental history, and other relevant information is integrated and interpreted by the lead psychologist. So in summary, psychologists lead the assessment process by determining the assessment battery, and they direct the psychometrist towards what tests to administer. Now, the psychologist also interprets the assessment results and writes the psychological assessment reports. They conduct therapeutic interventions, and they supervise the psychometrist. Now, what's the process of psychological assessments like? So the assessment process starts with a referral. Now, a referral can be made by a psychiatrist, another psychologist, a therapist, a physician, a pediatrician, or other mental health providers. So this referral tells the testing psychologist what exactly they want a test for. Then the next step is the intake interview. Now, during the interview, comprehensive information regarding the individual's symptoms, medical, developmental history, and academic performance, and all other relevant information is gathered. Now, after that, the psychometrist or the psychologist conducts a home or in-school observation to see how the individual typically behaves in his or her natural environment. Now, next, direct psychological testing starts. Now, the psychologist or the psychometrist administers and scores the psychological tests determined in the assessment battery. Now, and this happens by the psychologist, the determination of the assessment battery. So these scores are interpreted and integrated with other collected data and information to arrive at a diagnosis or to make a decision. The test results, diagnoses, and treatment recommendations are discussed during the assessment feedback, which is usually delivered to parents or guardians of the individual. And in the case of an adult assessment, it can be delivered to the adults. So then the client is referred to an appropriate provider of therapeutic services, such as psychotherapy, behavioral therapy, speech and language, occupational therapy, etc. Okay, and so why are psychological assessments so important? So let's look at the utility of tests in different settings. So first off, we have educational settings. Psychological assessments are useful in the school setting to assess the need for educational intervention or to establish or rule out eligibility for special education programs. So, for example, assessments are conducted to determine if a student is eligible to enroll in special advanced classes and determine if they have the aptitude to succeed in an advanced program. But assessments also help in the construction of IEPs or individualized education programs. So an IEP uses the scores obtained in the assessment to identify the area that a child struggles with and contains your child's present level of performance in school, individualized instructions, and supports like exam accommodations and assistive technology. So IEPs are found to be crucial in helping students perform to the best of their ability with the support of exam accommodations such as extra time and allowing scribes or allowing them to use laptops for writing during written tests. Now, within the clinical setting, the psychological assessments are mainly used to assess a person's cognitive abilities, personalities, social skills, emotional and behavioral responses, or interests in order to arrive at a diagnosis. Assessments are helpful because they guide treatment and therapeutic intervention. So, for example, it has been found that DBT or dialectical behavioral therapy is most effective for persons with borderline personality disorder. So without proper psychological assessment and a formal diagnosis of BPD, a person suffering from such a disorder might be distressed due to the symptoms that they're experiencing, and they might not receive the most applicable treatment and intervention. So, being able to provide the most applicable treatment intervention will effectively address the symptoms a person is experiencing, and will help improve that person's life or quality of life. Now, in the industrial settings, psychological assessments are used in the selection and classification process of hiring. And in research, assessments are also useful to gather data regarding a certain demographic. So, for example, psychological assessments are helpful to know if prescribing antidepressants to persons diagnosed with major depressive disorder, for example, is effective. So, assessments are no doubt useful and helpful. Now, understandably, some of us might not want ourselves or our children to be diagnosed, as diagnoses sometimes come with a stigma. So we get apprehensive by being thought of as labeled and seen not as a holistic person, but as nothing more than a diagnosis. However, receiving a diagnosis is such a critical component in providing accommodations and support, such as exam accommodations, therapy, and being able to join support groups. And it also provides opportunities for individuals to have resources, access to resources, and improve their quality of life on the whole. So, getting a diagnosis may also help a person in understanding why it is that they've experienced the symptoms that they've experienced, and it can provide enlightenment to any questions that they might have had. All right. So thank you so much. And your feedback is important to us. Please feel free to scan the QR code and tell us how we did, or send us an email, info@wellnesscenter.ky. Thank you so much and have a great rest of your day.